Okay, so I'm gonna go over all the equipment that you picked up so that you can work with that. So we have things that I want you to work with. One is a butterfly. You either got one in a baggie or you got one already packaged. These are what we're gonna use to draw some blood. We also have IV catheters because very commonly what will happen is that we will put in the IV and then we're going to draw blood from it. So we're going to make sure that you guys kind of go over that, which requires an IV start kit as well. If we're going to start an IV, we always have to make sure that we have it locked. And so this is the extension set that you get with your IV kit. That will be in your bag as well. And then we have various vacutainers. And vacutainers are different methods of holding your tubes so that they can be vacuumed, the blood can be vacuumed out of the patient into the tube. So this one works, these two work with the IVs, these work with other various apparatuses, but what you always want to make sure is that your blood tube can fit right in there, because if it doesn't, then you're going to have already gotten your blood and then you won't have any way of getting it into your tube. So always verify that your tube is going to fit into the vacutainer that you've chosen. All right, I have made my very own IV arm, and that's what I want you guys to do at home, is find some box that you can use in order to insert your needle and kind of get a feel of how you're going to have to move it around. Then we also have cleaning and dressing equipment. So we have one scrub, we have a couple of 2x2s, as well as alcohol wipes. Gloves, because we always maintain aseptic technique, and that way we have to be able to wash our hands. We also have different lab tubes. Different colors are for different tests. So purple versus red versus blue, and we're going to talk more about that. But they come in different sizes. It just depends on what you're trying to get. If this is for an infant, then this would be for an adult. So the first thing we're going to start with is the very specific piece of using a needle to get into a vein. So one of the ways that we do that, other than the usual aseptic technique and verifying the order, verifying the patient, making sure all that safety piece has happened, the next piece is to be certain of where you're going to put your needle. Usually we don't have people who are brand new at drawing blood use this particular technique because you pretty much have to know what you're doing when you're doing it. It's not going to give you any clue that you're in the vein. So we're going to start with the vacutainer. We're going to have our lab tube, and then you're going to have a specific vacutainer needle. And you're going to see this little rubber part. Don't get all excited and touch it because there's a needle underneath it. But it's going to go into your vacutainer. And then when I release this piece, there's going to be a needle here. So after I put my tourniquet on my patient and pop up my vein, then I'm going to verify that my bevel is up. And I'm going to enter straight into my patient's vein. There is going to be no way for you to know that you're in the vein until you put in your lab tube. And once you do that, it'll start popping back blood if you're in. If you're not in, then you're going to have to get rid of this lab tube because the vacuum has now been released and it no longer is good. So you have to start all over again. That's why people who have been doing this for a long time will end up using it, but otherwise, new people, I'm going to show you a better technique. All right, again, safety is always first. You do not take up a cap and you don't recap. You always scoop. So we're going to scoop, and then we'll be able to safely recap. All right, so if you're brand new to this, you can use the butterfly. And the reason we like the butterfly is because it's going to clue you in. Right here, you'll get a flash, and it'll tell you that you're actually in the vein. So you're going to go ahead, bevel up, clean. You're going to go in, and as soon as you're in, you're going to see a flash, and that'll allow you to release it, and now you can use your other hand, and you can decide how you want to draw blood. The most common way that we do it when we're using a butterfly is with a syringe. And we'll just hook it on and pull it back. And that way, when you're doing it that way, you can control how fast you're pulling blood. So you'll see it used for pediatrics when they have very small veins, or geriatrics when their veins tend to smooth down and collapse on you. And then when you're all done, you take your 2x2 and you just pull back out again. All right. These have that lovely little safety condition, so if you pushed up, it'll click and hide the needle, and so you wouldn't risk poking yourself later. The other way you can do this is to use what we call an alternate Vacutainer needle. So now if you notice, there's no needle on this because you're going to use it with another piece. So I can still use the same technique of going in, but now I can just use the Vacutainer tubes and fill them all up. So there's tons of different ways to draw labs, but you have to know which apparatus goes with which apparatus. Then we also have, if I put in an IV, when you put in an IV, you're going to do your tourniquet, do your cleaning, make sure it's all dry. When you go in with your IV, this one will be a little bit harder because it's not made to go into something quite so hard, and you pull the needle back out, then you'll end up with this blue piece outside of it. That allows you with the same end as the butterfly did. So you can use this piece, and you can put it in here and draw your labs. You can use a syringe, hook it to the top, pull your blood out, or you can use one of these specialized Vacutainers that are made to lock in, and then you can again use your tubes. So either way that you feel is comfortable. What you can't do for any IV is you can't fill your extension set up with normal saline, hook it in, and then draw blood, because then your saline will be all the way through this tubing and it'll mess up your lab results. You'll dilute the blood that you've drawn out and it'll end up with a different number than what is actually what your patient has. So usually the safest is to either go straight to the catheter or to not put any saline in here, put it on dry, and then draw straight from that piece. We're going to wash this off. Go straight from that piece. And then you'll be able to draw your blood back that way. All right. And that's it.